Every third Indian has fatty liver, and this is what the Union Minister Dr. Jitendra Singh, who is himself a renowned diabetologist, had to say. In fact, things are so bad that in Chandigarh, 1 in 2 adults has fatty liver. So in today's topic, we'll be discussing about fatty liver and what are the implications of fatty liver. So what is fatty liver in the first case? So your liver is an organ in the body that has 30 billion cells. That's crazy, right? And when fat deposits on it and it increases more than 5%, so let's say 5% cells of the liver have fat, that is when we call it fatty liver. Now what happens is, over the period of time, the fat gets deposited in the liver, right? So it leads to inflammation, and that leads to another stage called as non-alcoholic steatohepatitis. And slowly after that phase, you go to a stage called as cirrhosis, in which your liver literally starts dying. So the root cause of all these grades, as I mentioned now, is basically unhealthy lifestyle, eating too many calories, no exercise, right? And also other metabolic disorders like diabetes, high blood pressure, and everything. Today it is very prevalent. In fact, in the year 2040, we are expecting these numbers to be even higher. And what brings us all together on this issue is that it is very evident, right? If you go outside, आप देख सकते हो, like central obesity is very common today in India, and that is because of eating excessive calories and less activity. So when do we start understanding, or when do we start treating this disease? So first stage, as I said, right, only the fat is getting deposited. Then a little bit next stage is like inflammation ho jata hai, and fibrosis is in the sense scarring of the liver. Then the liver cells literally start to die, that is called as cirrhosis, right? And you'll find it strange that I've never mentioned anywhere alcohol in this video. This is why it's called as non-alcoholic fatty liver disease, which is also now the new term is metabolic activity steatotic liver disease. That's the new term. But let's talk about how do we, how did we get here first, in sense, as I said, the risk factors for that, and when do we start treating it? So we start treating it once it is established that there is inflammation and scarring. जो scarring होता है liver, अगर आपको liver scarred है, we have to treat it, and then there are some drug therapies for that as well. But the crux of this whole topic is that it is related to lifestyle. And if we eat a healthy diet, a high protein diet, we exercise, we control our sleep, then most likely we will not suffer from non-alcoholic fatty liver. And if you don't do all these things, we'll all definitely have non-alcoholic fatty liver. For context, my own dad has non-alcoholic fatty liver, and you can see it like when you go for an ultrasound, right? For any of the tests, I'm sure most of you do this complete whole body checkups, right? So then they will tell you कि यार आपको grade 2 fatty liver है, grade 3 fatty liver है. And these grades are basically, as I mentioned, right, the more they advance, like if it is grade 1, then just non-alcoholic fatty liver. But if you keep advancing, it gets worse. So I was on the topic where how can we even prevent non-alcoholic fatty liver from happening? That is completely up to us. Like, we need to exercise well, we need to eat well, we need to sleep well. And there are some amazing facts, that I went across, and I will like share you. It's especially like how we can actually reduce fatty liver, right? So there are like brisk walking for 150 minutes a week helps reduce non-alcoholic fatty liver disease. Light cycling for 30 minutes a day for 5 times a week is more powerful than popping pills. Exercise reduces liver fat. And one of the most important factor is weight loss in this whole topic, fatty liver. The moment you have weight loss, your chances of developing non-alcoholic fatty liver or even progressing in that disease is very less. Okay. Also, like, some people they go towards this detox things, right? आपने बहुत बार सुना होगा कि यार detox diet, detox something else, supplements. There is literally nothing in the outside like supplement that can detox. The liver is the only organ in your body that is made by God that can detox things. So you don't need to follow any detox diets plans, right? Okay. Another fact is, like, when we talk about diet, right, in the diet perspective, like we tell you that you need to lose weight. So how do you do that? First is that you get a calorie deficit, and most important fact is that so saturated fats like coconut oil, like butter, ghee, these should be in lower quantities, especially red meat. Saturated fat very high. You need to start reducing the amount of saturated fat in your diet, and along with a calorie deficit. Now, what are the some of the things that will be helpful for you in the diet perspective? So one, I told you that the calorie deficit should be there. Second, saturated fat should be less. Third is plant-based diets, like legumes, like grains. These kind of diets are excellent for treating like even progressing in the disease, because the whole crux of your diet should look like this. First, it should be calorie deficit. It should be high protein. It should be reducing the amount of saturated fat intake and having a lot of fiber, grains, and no processed refined carbohydrates, right? Refined carbohydrates or processed carbohydrates in the sense like burger ho gaya, pizza ho gaya. These things we really need to avoid to advance in this fatty liver disease, right? And exercise, as I said, right, 150 minutes a week of like brisk walking reduces the risk of fatty liver. Even like if you're doing strength training, you're doing weight training. Now strength training you can also do at home. You don't really need to go to a gym. You can start doing some movements at home as well. Yoga is not really the best way to treat like in this case, because what happens is in yoga na hum log it's not going to help you lose weight. So we do weight training or strength training to one, gain muscle, and then secondly lose weight by being in a calorie deficit. Yoga doesn't burn that many calories, but if you're doing like extreme forms of yoga and all and you think that yaar isse mera weight loss ho raha hai, then of course go for it. Now, another section I want to talk about, the don'ts, right? The don'ts are basically like herbal supplements, like detox diets, right? And what do you say, like, some fast gimmick supplements that you get. This Live 52 is there by Himalaya, and that its supplement is given by very commonly by doctors, and that can really cause issues. Like, there were some case scenarios that I also have brought, and I would like to, talk about them. um, Another thing is like with every hour decrease in sleep time from the recommended 7 or to 8 hours, the risk of fat deposition in the liver increases by 24%. So sleep is extremely important. Once you get your sleep matrix on time, then it literally becomes very easy to lose weight and also like not progress and further in the disease, right? I had brought some other points as well. Quitting alcohol, like even though this disease is, or the this phenomenon is not related to alcohol, you need to like stop consuming alcohol, and you need to stop smoking. Now there are some approved drugs for this, okay, like vitamin E and pioglitazone, but again these are only specific and under prescription aapko lena hai. It's not like I'm saying something and you can literally go and start taking any popping any pills or something. You need to consult with your personal doctor, and once he gives you the go ahead, then only like go for this. Also, like on the ultrasound, when you go for testing, it's just the ultrasound will tell you the grade. Now if it is further progressed, then they do something called as a fibroscan. These are little advanced aspects, but these terms get thrown around, so I just wanted to confirm, like, you confirm non-alcoholic fatty liver disease on the basis of a liver biopsy or even on the fibroscan. ठीक है. Only what you see fat deposition on the liver will be confirmed by ultrasound. जो आप लोग reports करते हैं ना, उसमें आपको पता चल जाएगा. And yeah, I said, right, these 4 5 metrics: calorie deficit, sleep, stop eating junk food, having your exercise schedule, walking, cycling, all these activities if you're doing, and if you're like a regular gym visitor, and you maintain a high protein diet, then you don't really need to worry about this non-alcoholic fatty liver. So I took this topic up in the sense like something very prevalent, something which is affecting a lot of people. At doctors, you can see, if you see central obesity, right, in any of these individuals, most likely they will be having this non-alcoholic fatty liver. And some lean individuals also can have this kind of issues, right? It's not only that if you have like central obesity, that's a pot belly, that you will have this non-alcoholic fatty liver. It also, like, if you're a lean individual also, you can have it. So it all depends upon diagnosis. When you go for your regular blood checkup and your complete body checkup, you can have this the doctor will definitely tell you, yaar, aapko grade 1 hai, grade 2 hai. So you should be aware, like, what kind of disease progression I am into. Secondly, also on the something called as liver function test, पे आपको पता चल जाता है, like AST and ALT. These are the two markers, and if they are extremely high, then it suggests some issues in the liver, and it can probably point towards non-alcoholic fatty liver. So this was the video, and I appreciate like any other queries that you all have. I can like in the comment section we can discuss about it. I'll make more videos on other topics that are extremely prevalent in today's case scenario. Let me know how you like this video, and thanks for watching.